So in some cases, it can be a little bit harder to diagnose Parkinson's, and maybe it does take a while for a patient to come to the proper diagnosis. I think a lot of those cases maybe involve folks who have a little bit of an atypical onset. So Parkinson's disease really has a whole spectrum of manifestations, and all of the symptoms that I talked about can be there in different proportions. So for example, I think if a patient has a typical resting tremor and maybe the walking troubles, and they say even their primary doctor, it may become pretty clear that that's Parkinson's disease. But 30% of patients don't have any tremor. 30% of Parkinson patients don't have any tremor. And maybe they'll present with soreness in the shoulder that's from rigidity. And they might go through several doctors and orthopedists and trying to figure out what is causing the shoulder pain. And when they finally develop enough symptoms or are referred to somebody who's familiar enough to sort of recognize all of the signs together, they may have a more clear picture, and then in hindsight, all of these symptoms that were thought to be related to other problems may well have been the first sign of Parkinson's disease.